My name's Pam. I'm 41 years old, soon to be 42. I've been thinking about having the breast reduction for many years. Just never really had the gumption, I guess, to do anything about it. A few months ago, I think just before Christmas actually, I spoke to my GP and she said that they can give me names of people that I could go and see. I was a bit concerned about going that route because I have seen online operations where perhaps the end result wasn't what I was looking for. So I decided I was going to do it all by myself. Went onto Google and I googled breast reduction, and ironically Aurora Clinic was one of the ones that I looked at. I went onto the website and I saw the actual procedure done on a lady, and was really amazed and pleased and impressed with the results at the end. So I thought, that's who I want to go with. Didn't want to go and choose too quickly who I went with, so I had a look at another couple of sites and I saw a couple of ops, and again really just wasn't very impressed with the end result, the shape of the breast at the end of the operation and how it looked post-op. Really wasn't what I was looking for. I wanted something that was natural and really to anybody else didn't look like I'd had the operation done. Basically phoned the Aurora Clinic and asked for my free consultation, and they were lovely, really nice, really helpful. Booked a time that was suitable for me and came in. And again, everyone was so nice when I came in, really made me feel at ease, and it was such a nice thing because I'm always quite nervous. Confidence was always a massive problem with me, I guess. So anyway, sat down, went in to see Mr. Richards. He asked me the size that I was, and I was a 32J, and what size would like to go down to. As small as possible, please. Basically went through all the details of the operation, what they required of me. Obviously I was a smoker, and they'd need me to give up smoking obviously for the operation, healing purposes and what have you. And because it was something that I really wanted, not a problem. Yeah, I can do anything you ask of me. If you want me to give up eating, not a problem, I can do that. So had the meeting. He had a quick look at my breasts and yes, said that they were very large for my frame, and yes, that he could help me. Obviously within the meeting I was very nervous and I'd actually written down a lot of questions that I wanted to ask, but completely overwhelmed by the whole situation. Although he was lovely to speak to, don't get me wrong, he was so very nice. So I didn't actually get to ask any of my questions, but the lady afterwards, she was lovely and she said, "Oh, I see you have a pad. Have you got any questions?" "Oh yes, I have." And she said, "Well, I can answer them for you." And we did. We went through one by one. There was no rush, there was no anything. Everything was dealt with so brilliantly. I just can't even tell you how brilliantly, really. So we went through each of the questions and I said about pain, how much pain is there, what type of pain is there, and she said obviously it's different from each person to each. I said about time off work, how long would I need. They say 2 weeks really. If you've had 2 weeks off after the operation, that you should be fine, depending obviously what your job is and what have you, and that was all good. Anyway, went through my questions and they were all answered brilliantly. I had all the answers that I wanted, and basically my question was how soon can I have it done really. And they said that they really liked you to have given up smoking for a month, but there is a leaflet that says that they will do the operation after 2 weeks, I think, of giving up, but obviously you have to stay off then for that 2 weeks. So from that time, no more cigarettes, that's me, I'm done. After my 2 weeks I phoned up and I made an appointment, and I went for the consultation at the beginning of March. and I was having my operation at the end of March, which was like, I was like, wow, I can't believe this is happening. Something's going to go wrong. It's not. How can this happen to me? Anyway, went to the hospital in High Wycombe, and again, the people were lovely. What can I say? They were all very, very helpful. Such nice people, and didn't make you feel that you were doing wrong because you were having an operation, cosmetic. They didn't make you feel that you were vain or what have you. They could see that I was unhappy, obviously, with my size, and I think a few people were actually quite shocked of how big I was before I had the operation. So the anaesthetist, she came into the room and she explained exactly what would happen, that they put a line into my hand, and obviously they'd give you something to make you feel a bit more relaxed and drowsy, and then the actual medication to make you go off to sleep. Obviously you weren't allowed to eat beforehand. I think 12 o'clock midnight I wasn't allowed to have any food. But obviously clear liquids they allow, so that wasn't too bad at all. But nervous, to be honest, so food, yeah, wasn't really forethought of my mind, really. Anyway, so I was given the stockings, the support stockings, lovely job they are, very attractive navy blue stockings, which made me feel very glamorous. Had those before I went down, put them on myself. And basically then they wheel you down to the theatre. They put the line in the hand. Unfortunately they had a few problems with me. I've got funny veins and they couldn't get it in. So after a few attempts they decided to use my arm vein, which wasn't a problem, and I went to sleep. So that was all wonderful. And woke up and yes, first looked down at my lovely small boobs and I couldn't believe it. It was such a shock. Smile from ear to ear, even though I felt, you know, kind of, I guess, a bit woozy after the anaesthetic, but who cares, I've got my little boobs. And that was me, really, and they came in to have a look at them, and the nurses came in and couldn't believe how willing I was to whip them out, which was such an unusual feat for me, really. Have a look, yes, everyone have a look at my new boobs because I love them so much. Pain-wise, I was very surprised, actually, when I woke up that the pain wasn't there really when I woke up. After a few hours there was pain, but it wasn't the type of pain I thought it would be, and nowhere near after having such a, I guess, a major operation. You're having so much tissue removed. It was really not that bad. I couldn't believe it. They gave me some painkillers anyway and the pain went off. That was fine. And yeah, the next day basically, less pain, lovely new boobs, and then went home. Journey home, well, yeah, that was a bit more tender. Obviously mind the potholes, that's all I'll say, and hold on to them and don't drive, because yeah, I had to hold on, and going over the potholes, they were a bit tender, obviously they're going to be. But after the first couple of days, really, didn't really experience hardly any pain at all, which was most surprising. Bruising wise, and I bruise quite easily, there was just some small bruising underneath the boob, both breasts and under the arm, which trailed a little bit back, but really not that bad at all. I was really rather impressed, and the tape that they put on after surgery makes it look like you've really hardly had anything done at all. Very neat, all very neat, no blood, no nothing. I was very impressed, very, very impressed. I went back to the hospital and they changed the tape for me and just had a look at how it was healing. On my left breast, it was still a bit open when she peeled back, but she was very pleased with the healing process that was going on. She retaped them back up, and that was, that was all good. She'd said that because I'd had more taken off of the left breast, obviously possibly a bit more trauma to that one. That's maybe why it wasn't healing quite as well as the right. So obviously you have to bear that in mind, that I guess the more you have taken away, the more trauma is there. So, you know, just sort of don't do too much, leave them heal, you know, rest up like they tell you. So yeah, had my tapes changed, was very impressed because it didn't hurt. I was a bit frightened about having the tape peeled away, but fortunately they were still quite numb underneath, so yeah, I was fine and that didn't hurt at all. Changed onto new tape, and as I say, you couldn't believe that you'd had such a major operation really. It didn't look like that at all. It was so clean, it was so tidy. Really you could have gone and posed and nobody would have known, in a small little skimpy bra, and you would have been fine. Comfort wise, again, it was still a little uncomfortable, but not really pain, it was just uncomfortable, and that's really all I can say. Obviously each person would be to their own. I had my first appointment back at the Aurora clinic. Everyone looked really pleased to see me, which was lovely. It was lovely to see everybody, and they couldn't believe like the change in me. Even just personality wise, I think, you know, much more bubbly. I'd been given a new lease of life, if you like. And even on from then, obviously it's been nearly 3 months, and yeah, I've had my hair cut, I've had it coloured. I'm just a new person. I'm even buying dresses for the first time in my life. I actually feel like a girly girl, which is very unusual for me. So to be honest, anybody out there who's even thinking about it, and don't think about the money seriously, because the money, there's no price for your well-being and life. You need to live life to the full, and I'm so very pleased that I had this operation done. The people here at Aurora have been brilliant, so very helpful, so very nice, and yeah, they've come the journey with me really. So I would recommend Aurora Clinic to everybody. And my surgeon, Dr. Richards, what a lovely man, brilliant. He was such a lovely chap. Made you feel such at ease, and the whole way through, and everyone's been so nice. What else can I say? Have it done, seriously, it's worth it.